phenomenon here, the lowering of the glucose and the elevation of the ketones. And in one case, it was managing epileptic seizures, and in the other case, it was managing the rate of tumor growth.
Intermittent fasting is one of the most searched topics among people facing cancer today. Patients, survivors, and families are asking the same questions. Can fasting help my body? Can it reduce side effects? Could it make treatments work better? Or could it be harmful? The internet is full of strong opinions, but very few clear answers. In this video, we are not here to promote trends or miracles. We are here to calmly explain what science really says about intermittent fasting and cancer, what researchers actually know, what remains uncertain, and why personalized medical guidance matters more than ever. Cancer is already overwhelming. Nutrition decisions should bring clarity and support, not fear or confusion. So let's slow down, remove the noise, and look at the evidence with honesty and care. What is intermittent fasting? Intermittent fasting is not a specific diet. It is a pattern of eating that alternates between periods of eating and periods of fasting. The most common forms include time-restricted eating, such as eating within an 8 to 10-hour window each day, and longer fasting periods that last 24 hours once or twice a week. Importantly, intermittent fasting focuses on when you eat, not what you eat. From a biological perspective, fasting triggers metabolic changes in the body. When food intake stops for several hours, insulin levels fall. The body shifts from using glucose to using stored fat, and cellular repair processes become more active. These mechanisms are the foundation of why scientists became interested in fasting in relation to cancer. Why scientists study fasting in cancer cells behave very differently from healthy cells. Healthy cells are flexible and can adapt to changes in energy availability. Cancer cells, on the other hand, often rely heavily on glucose and constant growth signals. This difference led researchers to ask an important question. Could short periods of fasting stress cancer cells while protecting healthy cells? Laboratory and animal studies have shown that fasting can activate protective stress response pathways in normal cells while making cancer cells more vulnerable. This concept is known as differential stress resistance. In simple terms, healthy cells slow down and protect themselves during fasting, while cancer cells struggle to adapt. This idea sparked interest in whether fasting could support cancer treatment, not replace it, but possibly enhance its effectiveness or reduce side effects. What animal studies show? In animal models, intermittent fasting and calorie restriction have been associated with slower tumor growth and improved responses to chemotherapy in certain cancer types. Some studies show that fasting cycles may reduce inflammation, improve insulin sensitivity, and alter growth-related pathways that influence cancer progression. However, it is critical to understand that animal studies are not human studies. Mice have different metabolisms, different tumor biology, and controlled environments that do not reflect real patients dealing with weight loss, fatigue, stress, and complex treatments. These studies are valuable for understanding mechanisms, but they do not automatically translate into clinical recommendations. Human studies. What we know. So far, human research on intermittent fasting and cancer is still limited, but growing. Small clinical studies and observational research suggest that short-term fasting around chemotherapy may reduce certain side effects, such as fatigue, nausea, and gastrointestinal discomfort in some patients. Some patients report better tolerance to treatment, but these findings are not universal. Importantly, there is no strong clinical evidence that intermittent fasting cures cancer or prevents cancer recurrence. Most cancer organizations and oncology societies emphasize that fasting should never replace standard treatments, such as surgery, chemotherapy, radiation, or targeted therapies. Current human data supports the idea that intermittent fasting may influence metabolism, inflammation, and treatment tolerance. But its effects vary widely depending on the individual, cancer type, treatment stage, and nutritional status. The role of metabolism and insulin. One reason fasting has attracted attention is its effect on insulin and growth factors. Insulin and insulin-like growth factor 1, known as IGF-1, play roles in cell growth and division. Elevated levels of these hormones have been associated with increased cancer risk in some contexts. Intermittent fasting can lower insulin levels and improve insulin sensitivity, particularly in people with metabolic conditions such as obesity or type 2 diabetes. Some researchers hypothesize that reducing insulin signaling could slow cancer-related growth pathways. However, this effect is complex and does not apply equally to all cancers or all patients. Cancer is not one disease. One of the most important points often missed in online discussions is that cancer is not a single disease. There are over 200 different cancer types, each with unique biology. Breast cancer alone includes multiple subtypes with very different metabolic behaviors and treatment needs. What may be appropriate for one patient could be harmful for another. For example, patients with advanced disease, unintended weight loss, or muscle wasting may be at serious risk if they restrict food intake. In these cases, maintaining adequate nutrition is essential for survival and treatment tolerance. Intermittent fasting. During chemotherapy places enormous stress on the body. While some early studies suggest fasting may protect healthy cells during chemotherapy, oncologists remain cautious. Chemotherapy already increases the risk of malnutrition, dehydration, and weakness. Most cancer centers agree that fasting during chemotherapy should only be considered under medical supervision, if at all. Patients should never fast on their own during treatment without discussing it with their oncology team or a registered oncology dietitian. The goal of cancer care is not just to attack cancer cells, but to support the entire body through treatment. Potential risks of intermittent fasting in cancer. Intermittent fasting is not harmless for everyone. Risks may include unintended weight loss, nutrient deficiencies, fatigue, dizziness, low blood sugar, and muscle loss. These risks are particularly concerning for older adults, patients undergoing aggressive treatment, and those with advanced disease. In cancer care, nutrition is therapy. Adequate protein, calories, and micronutrients are essential for immune function, wound healing, and recovery. Any dietary approach that compromises nutritional status can negatively impact outcomes, breast cancer, and fasting. What research suggests? Breast cancer is the most common cancer among women worldwide, and it is one of the most studied in relation to metabolism and diet. Some observational studies suggest that shorter nightly fasting windows may be associated with better metabolic health in breast cancer survivors. However, these findings do not prove causation. There is currently no clinical guideline recommending intermittent fasting as a standard approach for breast cancer patients. Research continues, but medical professionals emphasize individualized care based on treatment type, hormone status, and overall health. Fasting, inflammation, and the immune system. Chronic inflammation plays a role in cancer progression and treatment side effects. Intermittent fasting has been shown in some studies to reduce markers of inflammation and improve immune regulation. This may partly explain why some people feel better when following time-restricted eating patterns. However, inflammation is not inherently bad. The immune system needs energy and nutrients to function properly, especially during cancer treatment. Balance is key, and aggressive fasting may suppress immune function rather than support it. Integrative oncology perspective. Integrative oncology takes a whole-person approach to cancer care. It combines conventional treatments with supportive strategies such as nutrition, physical activity, stress management, and psychological support. From this perspective, intermittent fasting is viewed as a potential tool, not a cure. Integrative oncology emphasizes personalization. Some patients may benefit from gentle, time-restricted eating under supervision, while others may need frequent meals to maintain strength. There is no one-size-fits-all solution. What major cancer organizations say. Most major cancer organizations agree on one central message. There is not enough evidence to universally recommend intermittent fasting for cancer patients. Ongoing clinical trials are exploring its safety and potential benefits. But until results are conclusive, fasting remains an experimental approach. Patients are encouraged to focus on evidence-based nutrition strategies, including balanced meals, adequate protein intake, and maintaining a healthy weight during and after treatment. The importance of medical guidance. If you are considering intermittent fasting and have cancer, the most important step is to talk to your healthcare team. Decisions about fasting should involve oncologists, dietitians, and other professionals who understand your medical history and treatment plan. Self-experimenting based on online advice can be dangerous, especially during active cancer treatment. Hope. Without hype, science advances through careful research, not promises. Intermittent fasting is a fascinating area of study, and future research may clarify who can safely benefit and how it might be integrated into cancer care. But hope should never be built on exaggeration. True hope comes from knowledge, personalization, and compassionate care. Intermittent fasting and cancer is a complex topic that deserves thoughtful discussion. The current evidence suggests potential metabolic and supportive effects in certain contexts, but it does not replace medical treatment, and it is not suitable for everyone. Cancer care must always prioritize safety, nutrition, and individualized decision-making. If you found this video helpful, please consider subscribing to the channel. We are committed to sharing calm, science-based, and compassionate information to support people affected by cancer. By subscribing, you help us continue creating educational content that empowers patients with knowledge, not fear. And remember, you are not alone on this journey.